So we will be talking about children, and just to qualify that I'm not going to be talking about any specific disease trajectory. We are going to talk about children in general and how do we deal with children, how do we talk to children, what are some of the emotions that may come up, what are some of the issues that might come up when there are children involved in a palliative care setting. So I'm not here to talk to you specifically about children who are living with conditions, although we're going to touch upon it, but this is just generally children at large. I will leave you with some resources that you can tap into later if you're specifically interested in contextual settings like, dealing with children with, say, neurological conditions, or dealing with children who are of a certain age group or anything of that sort. Okay, but quickly before we start the session, I'm going to ask for a few more cameras to be turned on as usual. But also I want to just check how many people here have experience working with children in any setting, in any kind of setting. You can just give me a thumbs up, or you can use the emoji. If you have any, okay, Parag, Payal, Seema, Hannah. It's 4 people. Anyone else? Parag, you want to tell us a little bit about the work you have been involved with with children, please?
So my work was doing in my palliative care project, sorry, in my HIV project with children living with HIV, children and adolescents basically living with HIV, and sometimes when both their parents they've lost their parents in cases like, and there are children who are caregivers in some cases, which was quite a shocker for me when I started working. So in some cases, I've witnessed children as caregivers in the HIV setting as well to their parents, and some people who had experienced grief at a very early stage and age in their lives. So and there were times when there were discordant siblings as well. One of the child was HIV positive child, and the other child wasn't. So the kind of conflict and the kind of otherization that used to happen in within among the siblings, and so and most of the times these children used to live with their guardians, and somebody had to take them, and the kind of challenges that they faced, and the guardians used to come helpless, and they used to feel how we don't know how to support this child because can we just put them in some orphanage or in a boarding school. So a lot of abandonment anxiety, a lot of shame, a lot of and eventually when these children started growing up, we also saw that their relationships, like the adult relationships, also had some used to have something that came from their childhood experience of abandonment anxiety, and it affected their relationships, their adult relationships, especially the intimate relationships. The constant feeling of they're going to be abandoned, they're going to be left, and there used to be conflict. So that as well. And again, also there's shame, like most, and there was this not being heard. Somebody to be didn't they say that children are seen but not heard in most cases. Like nobody wants to know how they are doing, and with stigma, it becomes even more, I guess, severe in these cases. So, yeah.
Thank you. I think you've painted a pretty comprehensive picture of what any of these settings can look like, situations can look like. I mean, of course, when you have a stigmatized disease also in the mix, that adds another layer to it. But you've touched upon some very interesting um, aspects, which actually, as you were speaking, I've just added a couple of more slides to my presentation. So hoping that if I go over time, then it's Parag's fault. So someone has said, okay, so we have someone who's worked with educating children with a cerebral palsy, and observed sessions in the OP with palliative care physicians. All right. Apart from what Parag has highlighted, would anyone else here like to share any?
There's one more thing I'd like to add, that was invisibilization. That also I experienced recently, like the last week when I visited the field. I came to know that there were the villagers in that village were constantly kept mentioning, यहाँ पर भी एक patient है वो पागल की तरह बात करते हैं. This was इनकी माँ है, इनकी माँ है. Like the and the guy was like 11 to 12 years old, and like, he was standing there, and like 15 to 16 villagers around him. इसकी माँ भी ऐसे पागल की तरह करती है, and there was no, and he was listening. I was wondering how he's processing it, and especially in COVID, I also saw that there's nothing much that has come out. How did children experience COVID? So that again, there's no documentation about it. Yeah, invisibilizations.
So thank you very much for this. Parag, you've set us off to a good start, I think, for today's session. I'll take a couple of more minutes to ask anyone else here who would like to share either through the chat option or by unmuting. What are some of the experiences you might have had, or a difficulty that perhaps you were not, that you struggled with, or maybe even a success that you had? Anyone else? Okay, all right. In that, Payal, I see you unmuting, or you've got your mic to your, yeah, you're still on mute, Payal. Yeah,
Yeah.
there you go.
So I have worked with children who have cerebral palsy. There's a school here, but this was like what happened is I assumed that the parents used to come and keep their children there on the pretext that they would get something to eat, and from time to time they would be fed and taken care of it, and especially when the parents are working somewhere, so this was like a huge relaxation for them, that okay, my child can be taken care of. And but anytime we used to call them for anything to be told about the child, none of the parents used to come. So we used to feel very bad about that, but at the same time we used to feel that if she would leave her work and come, probably the place where she's working would just throw her out, saying that how many leaves you want. So from our side, we were doing all that we could, and education in the form of, with educating them with toys, with video games, with showing them in a very non-conventional way. It was very different. It was like a family. But, this COVID, I think it spoiled the game. These children went through such bad stress during COVID because they had become, the empathy with them and the bonding with them. We had become like a family, all of us who all were working there. And suddenly this COVID struck and everything went for a toss. Then the government funding also had stopped. Only very recently it has restarted, and they are saying that again they need funds. So I feel there is lot of, uh, there is no funds. They say that government is giving, but where is it going? I don't understand. So I feel I'm not happy with the situation. As much as I want to help, I think, I'm falling short in all ways.
I wouldn't say you're falling short, Payal. I think you've done a tremendous amount of work. I think what also is coming through is the intersectionality of so many other issues like poverty and policy. And none of us can really operate in a vacuum. So for us to be able to deliver our services of a certain quality, the ecosystem around us has to actually support it, and which is what is being highlighted in what you're sharing today as well. So also this speaks to the invisibility that Parag talked about, that certain issues are less visible than others, maybe because it's not impacting in a particular way. So thank you both for your shares, and I invite you all to please use the chat when and as and when you have something to reflect on or a question to ask, and I'll keep coming back to it. So let me just get started with our session today. Arya, just let me know, please, if my screen is visible.
Yes, ma'am, it's visible.
All right. So like I said, today is just an overview. We're just going to discuss several different concepts together, and I'm very curious to know what some of your experiences might have been along the way, and if there's anything that we can sort of discuss together and hopefully help a few of us problem solve. Okay, now just talking about childhood and palliative care needs. Childhood, first of all, let's qualify, is considered to begin from the perinatal and neonatal period till 18 years of age. The number of children in need of palliative care services worldwide is estimated to be over 21 million. At least 8 million children out of the 21 million need more specialized services, very special services. 95% of children globally who need palliative care have limited to zero access. Approximately 78 countries, there is no known pediatric palliative care. So all we're really saying with all these numbers is that there's a huge gap. Some of the conditions that warrant pediatric palliative care, so not just cancer, but congenital disorders and anomalies like some of you might have mentioned, metabolic conditions, autoimmune conditions, HIV, AIDS, organ failure, cancer, neurological degenerative disorders. So in our care, we have seen all of these different categories presenting. In India, there's approximately 9 million children living with life-limiting and life-threatening conditions. 5 million of them would benefit from palliative care or require palliative care, but less than 1% have access to it. So again, abysmal numbers. And most of the pictures, actually, if not all the pictures I'm going to show you in this presentation, with consent taken long back, are all children in our care. We have taken care of each one of these children in all of these photographs. And so we've intimately known a lot of these families. And a lot of what I'm sharing with you today really is drawn from my experiences in the children's palliative care sector, and also drawing from, the literature around for the longest time was coming in from the West. Of course, now we have a few handbooks that are India specific, but by and large, initially all the information was coming in from the West, especially when it came to neurological degenerative disorders and so on and so forth. Now, there is a surge of interest in pediatric palliative care, and some of the, there are some centers that are doing exemplary work in this field. Okay, so firstly, let's talk about some of the psychosocial issues that arise specifically when the patient is a child. Okay. Unlike of course, family dynamics plays a huge part in any kind of illness experience, but here specifically also they have a very high impact. You'll find, everything comes to center around the child. Of course, that is always the case. But when one child is unwell, every decision in the family starts to be in lieu of that child's needs. And coping styles. Parents might have different coping styles. They might have different decision-making processes. And time management, like, you said, sometimes having a child in respite care is a relief to the family, not because they're going and relaxing, it's because she can finally go to work at that time, right? So there are several moving parts. There are several factors that are influencing this. The fact that the child is completely dependent on the parents and is sometimes not able to speak adds to that layer of complexity and compounds the issues that the family might face. And single parents may face additional burdens and require specialized support, such as rehabilitation or financial assistance. And this, I'm not randomly just saying single parents. I think we've talked about it in one of the previous sessions, that there are some stigmatized disease conditions that lead to the woman being abandoned after the child is born. Especially we see this in congenital anomalies in some sections in India, where the blame is placed on the woman, and therefore, the man moves on, he marries somebody else, and she's left taking care of a child with a congenital anomaly. And very often she herself may not be very well educated. She may not have had to ever fend for herself in terms of financial security. And so these things become a great issue. Okay. Parag talked about the needs of siblings, right? And the differences, like what might arise if one child is sick, if one child is not. And this is a very, very important issue. And so, Parag, for the longest time, we call them our invisible patients. Because especially when one sibling is unwell, every bit of attention goes to that sibling. And this child is expected to grow up, take care of himself or herself, go to school, perform, do all those things that normally require the full attention of a parent. And preventing neglect and ensuring the well-being of all children, including siblings, in the plan of care will empower them to contribute and care for the patient as well. So very often what we did is the child who was in relative good health, we would involve that child in the, say, physiotherapy, or we'd say, come and help us with, so direct care to the sibling, to their sibling, and also to pay special attention to them. I'll tell you a little bit more about how we started a toy donation drive some time back. I mean, I'm talking about 2015. And very often what would happen is the parents would bring the child to our clinic, and they couldn't possibly leave the other child alone. So the other child would also come along. So here are children who are healthy and well, sitting in a clinic where there are children with all manner of illnesses. And some of them are having violent outbursts. Some of them are having, are in extreme pain. So for a child who's not experiencing that kind of disease, it's very traumatic to sit and watch this happen in other children. And but they had nowhere else to go. So the other thing, we found that a lot of these children were from extremely impoverished families. So we actually took a photograph of a child. I put it on Facebook, and we said, if any of you have secondhand toys with this specifications, then please send it across, because we had to be careful of not having, toys that had batteries, or we didn't want toys with like fine plastic fiber and things like that, especially when children are not well. And the amazing thing was, within 72 hours, packages of toys started coming in from all over the world. And so it was not just for the patient, it was also for the siblings. And when I remember this so many times, where I went to a child and I gave this child, the sibling, a toy, they would be shocked that it was for them. And because that's the kind of lack of attention they received, because always the attention was on the child who was more sick. And it's natural. It's not something that I'm criticizing the parents. It's very, very difficult, those situations. But the frequency with which we were received with surprise by a child receiving a toy was actually, it was poignant and also sad. Okay. But more than that, also involve them in the household, involve them in the care of the patient, because you don't want them to believe that they have nothing to, this is their sibling after all. We know families where multiple children in the family have the same or varying conditions. And the burden of care on the caregiver must be considered, not just from a medical point of view, but from a social context. This picture, these are 3 of the children. We looked after them. The oldest and the youngest both had varying levels of cerebral palsy. And the middle child, Bilal, did not. So this middle child was around both his siblings all day, looking after their needs. And why 3 children? Because the family had insisted, after the first one was born with cerebral palsy, that the daughter-in-law must have another child. The other child he came out without cerebral palsy, but then the family felt that no, there should be a third child. And they were hoping for the third child to also be, in quotes, normal. But unfortunately for the family, the youngest also had a different kind of disease condition. So can you imagine the pressure on the mother, having not 1, but 2 children with high dependency needs, and a third child to whom she has to pay attention? There was great amiability amongst the 3 brothers, primarily because the one in the middle, he was asked to participate in the care of his siblings. But it was a lot. It was a lot for the mother. It was a lot for this middle child, a lot of responsibility on his little shoulders. Other challenges that we see in pediatric palliative care settings is just the sheer lack of access to care and appropriate services, because we don't have enough pediatric palliative care services in the country. And I've already told you the numbers. Because there are such few pediatric palliative care centers in the country, families have to travel a long distance to reach them. And this adds to the practical and financial burden. Now, it's physically and emotionally draining, and especially when the child is in a serious condition. So I remember a child with chronic kidney disease who had, the disease had advanced to a level where it had also impacted his bone density and so on. And this child would come into the clinic with his parents. And there was one time that I met this child. He was all of 8 years old. He had 7 fractures at that time. In that moment, he had 7 fractures. Can you imagine traveling with a child with 7 fractures on a bus and a train? and what it did. I mean, the pain, of course, but also just the emotional impact on the whole family. It was not a short journey because they would come to Trivandrum from somewhere in um, um, interior Tamil Nadu. So from a village near Shivakashi, they would get a bus to Madurai. From Madurai, they'd get a train to Trivandrum, and then they take a bus and come to the clinic to see us to get the erythropoietin and other, CKD medication. But the child had to come because the child had to be administered these medications. Till finally, we managed to get in touch with somebody in the Madurai region to go and administer these medicines to the child right then and there. The other thing was they had a second child that they couldn't leave behind. So they had to bring the other child also along with them, all the way from that place near Shivakashi, all the way to Trivandrum. So it's not a simple thing to consider all of these different issues that people today face because of the sheer lack of services available to them. And so we have to consider it's not just the medication, it's not just the treatment of the disease, it's also all these things that we have to consider. Okay, and it can also create logistical issues. And yeah, once you come to Trivandrum, you have to find a place to stay. Also, let's not forget loss of wages for the time lost at work. So especially when you're traveling with two children, and if a child, forget a child having 7 fractures, even just a child who is in distress, it is not easy for one person in the family, one parent, to travel with that child. So usually both the spouses are taking that time off, which means loss of income to both sides, both parents. So what happens? Okay, you know what? It's just not worth it. We'll just deal with whatever happens at home, and we won't go to the clinic. So a lot of the families just stopped coming because the uh, the production it was to bring the child across for medication to them outweighed the benefits. Okay, and the suffering that they had to endure along the way. So that leads to non-compliance. Um, Also, our complex healthcare system. First of all, navigating it can be extremely complex for families dealing with a child's serious illness, and coordinating care across multiple providers, obtaining approvals, authorizations, financial concerns can be overwhelming and create additional stress for already burdened families. And on a significant number of occasions, after the child has died, we've seen families falling apart because the strain that the disease has put on the family has been way too much for them to bear. So oftentimes we'll find that the parents have split up, also because their way of managing their own grief has been vastly different. Okay, so this is a little boy who came into our care. He and his brother both have juvenile rheumatoid arthritis. We're all very good friends. He is now working at a florist, and I tried to get him into bird watching, but he doesn't want to have anything to do with it. But they actually really took to our team because theirs was a classic case where it was juvenile rheumatoid arthritis. The father had been very involved in their care, and then the father died in an accident. So we only saw these children 3 years later, and that's when we realized that the father had died, and so the mother had to go to work full time and therefore could not bring these two children in. Both of them had GRA, and the damage that had happened, or the deterioration that had happened in those 3 years, was quite significant. And advanced way too far for him to have any semblance of I mean, he's now using a wheelchair and things like that. So just the fact that the mother did not have support in those 3 years actually led to the deterioration of the disease. But we are seen as a respite care place for them as well. So often, and the mother, because she was carrying Rahul all the time, over a period of time, developed a bad back. So her own health deteriorated. So this is where sometimes respite care becomes very important for that one parent who's trying to manage everything, because then they're at least assured of some quality of care, and they can at least, if not go back to work, at least recover and recoup themselves. Okay. Other challenges also include the loss of education. A child's education is not really prioritized once they're sick. So this is Rahul. This is the brother of the boy I showed you in the previous picture. Rahul was a nerd. Okay, he wanted to, all he wanted to do was read. He wanted to watch movies. And he was very adamant that continues to be able to do that. Once he transitioned into a wheelchair, that became difficult. So we actually had a conversation with the school, and the school was kind enough to move his classroom from the first floor to the ground floor, so that his grade, whichever class he was in, would always be on the ground floor, and he didn't have to be excluded from his education because he had to navigate steps and there was no one to take him. This child would also refuse to use the bathroom the whole day because because other people would have to get involved to take him to the toilet, and he didn't want that. At this point, I also want to make a note of us having to acknowledge and hold up a child's sense of dignity. This is also the same child when he transitioned into a wheelchair. He was hoping for a knee replacement surgery and things like that. And we'd had a couple of instances where a junior doctor had told him that he will be able to run again. And once that junior doctor told him that, that's all he got fixated on. So it took some time for us to sit down and break that bad news to him and his mother, saying that he will never walk again and that he will have to use a wheelchair. And I remember having that conversation. It took 3 hours for us to have that conversation. And the mother seemed to accept it. She already sort of knew somewhere. But few days later, when we got him the wheelchair and we were wheeling him around and we were encouraging to learn how to use it, he just stopped. And this is a very cheerful child. He just stopped and he just wanted to be left alone. And it's later we realized when we spoke with him that being in a wheelchair really brought to him the reality that he was never going to walk again. Till then, he had hope. So we need to remember that all these things that we talk about as adults, dignity, hope, autonomy, these are as important to children as well. And we must never forget that. Okay. And siblings' education may also be hampered because of financial constraints, inability to focus. A child just loses, if there's so much going on at home, the child's they start acting out sometimes, or the sheer ability to concentrate at studies and all that, it takes a beating. So we have to remember those things as well. And emotional neglect can also lead to a decline in their ability to pay attention in class and so on and so forth. So there are many, many different things that we need to be aware of and just be cognizant of when we are dealing with children in these settings. Okay. I'm just going to stop for a second. Okay, having gone through that first broad overview, is there anything that anyone here would like to share or any questions that you have before we move on to the next section where we're going to be talking about how grief is experienced in children?
So you had mentioned about the other siblings. So this happened at Tata Memorial in Mumbai, and St. Jude Childcare Center is a childcare center for children who are taking the cancer treatment in Mumbai. And it's like a place for them to stay, for the family to stay. And most of them come from other states in India. So one of the child was taking his treatment over here with his family. Both the parents had come all the way from Uttar Pradesh, and so the chemo was about to start, and the other sibling, the older sibling, was in the native place, and something happened, and he was playing, and he just fell down from the terrace, and he died. And so, yeah, and this grief, that was just a kind of unimaginable grief. I mean, I felt so helpless and guilty at the same time. It was, so they were in this thing with dilemma as to should we just give up this treatment and just leave everything and just go back to UP. So it's just a thing that happened to share.
Thank you, Parag. These multiple tragedies or these compounded tragedies, I'm afraid to say that they are far more common than we imagine. And it's so difficult. I mean, sometimes, our privilege prevents us from actually seeing how, what the cascading impact of a disease is in a family like this. And, to your point, Parag, I mean, I remember actually witnessing this where we had a mother, both her daughters had end-stage kidney disease, and she was a match for both of them. And the doctor told her to choose which child she wants to donate her organ to. And so here was that mother who was in that absolutely impossibly difficult situation. And the sad thing is she took so long to make up her mind that both the kids died. And So I would say that, bad communication was a problem in the case that I just talked about, right? I mean, no, no mother should have been made to make that choice, even if that were true. But so there are all these different issues that come up, and what makes it, I would say, infinitely harder is dealing with it because we have children involved. And it's different when we're dealing with adults. I'm not saying it's any less sad, but it's the processes involved are slightly different. So if all of you are okay to move on, I'll move on to the next section, which is we're just going to talk a little bit about grief. I'm going to be doing an entirely different session with you on grief and bereavement in a two-part session where we're talking about grief in more detail. But right here, let me ask you, what are some of the ideas that people have about children and grief? Grief and children. What comes to mind? It will make them stronger to deal with the world. What else?
I
Grief.
feel sometimes, parents or the society thinks that they are still very young to even think about this or even process about this. And we assume that we are the ones who are supposed to take decisions for them, or they might not know anything. They're very young to do things. So it's very assumed that we actually take decisions for them.
Yeah, it is that you're absolutely right. And I can see lots of very pertinent responses. The child has gone to a better place. People feel children don't have anything to grieve about. Yeah, yeah, they don't understand grief. Children don't feel grief. Okay, let me flip this a bit. We've all been children, no? We were not born like this. Do you remember feeling sad or grief as a child? Do you remember any instances where you might have? Okay, Lucky Pile. Okay, so here's the thing. Uh, okay, um, these are some of the misconceptions, and some of you have already touched upon it. Okay, children are too young to understand. First of all, this is false. Children comprehend much more than we adults realize or like to acknowledge. The other big one is we have to protect children from loss and pain. We have to protect them. The problem is that if we protect children from loss and pain, they don't learn how to cope with it in a healthy way. Human beings are going to experience loss and pain in the course of their lives. And we have to be able to initiate children in a healthy way in how to deal with it. If you keep a child away from it, if you deny their reality of their loss, of their pain, you're basically not allowing them to develop the skills in order to navigate that space in a healthy way. If children are not expressing it, they're not feeling it. Arey, khel raha hai, kya hai? Why do you want to jabardasti go and talk to this child about this? Let him be, no? So while children may not express grief in the way that adults do, they do feel it in their own way. They just may be expressing it in a different way. I'm so scared I may not, what can I say to a child? I don't know how to talk to a child. I may say the wrong thing. The most important response is one of honesty and compassion, and we'll talk about this a little bit more in detail. If somebody has died in the house, we tend to avoid reminders of the deceased. No, don't talk about that person. Yeah, no need to talk to this child about, what happened. We think that by not talking about it, we're protecting them. But what we're really telling the child is that it's wrong to think about the person who died. So by taking away reminders, what we're really giving them the message is it's not okay to talk about this person. So even if that child had something to express, what we've done is we've taken away the permission to do that. These are just some common misconceptions. So we're just going to go and try and understand some of these issues a little bit more in detail. The other misconceptions is that children are resilient. They will bounce back. But we have to remember that children are not immune to the profound effects of grief. And they express their emotions differently, but their pain is not real. So to say that they'll forget about it, this is not going to impact them later on in life, so just leave it, we don't have to go there with them, that's not correct. Of course, we've said that children don't understand death, but even very young children have a more nuanced understanding of death than adults assume. And while their comprehension is limited, they are actively trying to make sense, even as it's happening. Children shouldn't express negative emotions. Allowing children to express a full range of emotions is very, very critical to not just a healthy grieving process, but to their personality development. They need to be able to have an outlet for negative emotion in a way that feels safe, in a way that is not going to be destructive to other people or to them. And it's only when we gently guide them into these or through these dark places are we really telling them how to navigate it. Okay, so it's not okay to express to expect a child to only express joy and happiness and all of those things, and the child has to be happy at all times, and crying is a bad thing. No, don't cry, everything will be okay. You're basically denying them something that is a very real and profound feeling in them. Okay, so we have to be careful that we don't dismiss their reality like that. So firstly, I'm just going to take this through. It's a developmental psychology perspective. Some of you who have studied developmental psychology are familiar with this, but I think it's really essential because we club children into one big box, but children respond differently through different developmental stages. Okay, and depending on where they are in their developmental stage will determine how they respond to difficult emotions and situations. So let's look at from birth to around 3 years of age. Children are mostly pre-verbal. They haven't learned to really articulate themselves in language, and they are focused on their immediate needs and emotional security. That's what their focus is, and there is little to no comprehension of the permanence and finality of death. Okay, and we're going to go into this, the core concepts of death in the next couple of slides. By early childhood, which is 3 to 6 years, they began to grasp the core concepts. Like I said, I'll just tell you what those core concepts are. Their fears and misconceptions often come from limited understanding, okay, not from anything else. And at this point, they believe that death is caused by external forces like accidents and things, and that they can escape it somehow if through their own efforts. And this is also a time of magical thinking for children. So this is a time when there's a lot of surrealism in the way they think, or magical thinking that they have, and it's okay. It's absolutely fine. But this is for us to know how children are processing their environment and their reality. By middle childhood, which is from 6 to 12, they start to develop a more nuanced comprehension of death. They recognize both external causes like accidents as well as internal causes like illness. But they're still at that age where they might still personify death as, a grim reaper, or this is a kind of Western concept, but in Indian settings, we might have some other idea of it. And also, we're not completely growing out of our magical thinking era. So some children at this age still believe that they can avoid or postpone death through their own creativity and ingenuity. Okay. And you see this also in the storybooks and in some of the things that they're drawn to at this point. Okay. So developmental concepts as per their developmental stages. Now, some core concepts about death, and this is not just for children, it's all for all of us. The irreversibility and permanence of death. Death is permanent. There's no return to life from it. And people who die are not coming back. That's concept number one. Concept number two is causality. Death is caused by the breakdown of bodily function. I'm talking about at a very physical level, okay? The third is that death is not just inevitable, it is universal. All living things must die eventually, and that it happens to everyone. The fourth is cessation, which is at the time of death, all bodily processes like breathing, eating will cease to function. And lastly, applicability. Living things can die, not non-living things. Okay? So, can I just spend a couple of minutes here with all of you? Any thoughts, any reflections? Because while we all think about death and dying, I mean, you're all here interested in palliative care also. I'm sure some of you are interested in end-of-life care and in what we call, thanatology, which is the science of death and dying. I invite you to also now share some. So it was quite late in my career that I came across these core concepts about death. I mean, it seems so obvious. They are obvious things, but I think these are fundamental things. Yeah, Shanmugapriya, please, go ahead, unmute. Shanmugapriya, can you hear me? Did you want to share something?
Ma'am, you are muted.
She's unmuted.
Okay, but we can't hear you, ma'am.
I think she's mentioned something in the comment section. She wants you to go
Captain
through it, I
Manif.
guess.
Yeah. All right. So I'm hoping that you can resolve that technical issue. Okay. And in the meanwhile, we'll come back to you. In the meanwhile, anybody else? Let me just pull up my screen again. The core concepts of death: irreversibility, permanence, causality, inevitability, universality, cessation, and applicability. What are some of the thoughts coming up for all of you when we are looking at these core concepts of death? So for me, when I first came across them, I thought this is actually a really good way to break this down. And because death as a phenomenon, as a word, it's huge and complex and too much to talk about. We don't always know how we're going to talk about it. But here, these are some inroads into having those conversations with younger people. And this is really, I mean, it's called a core concept because it is a fundamental concept. And these are the things that happen at least at a physical level when somebody dies. Now, how do we apply this to when we are talking to children? Okay. Now, firstly, we need to, I'll go back to our developmental stages and the core concepts. And now in this slide, I'm bringing them both together for you. Early childhood, 3 to 6. In early childhood, children have a limited understanding of death. They may see it as temporary or reversible. So they don't have the irreversibility or the finality of death. They have difficulty grasping that it is final, it is universal. They may believe that the deceased can still think, feel, and function. Okay. Middle childhood, 6 to 10. As children enter middle childhood, their understanding of death becomes more concrete. They grasp the irreversibility and the inevitability of death. They can apply the concept of death to others. However, they may still have difficulty understanding the abstract and universal nature of death. Okay, so a few more concepts are falling into place for them. By late childhood, most children have a more mature and adult-like understanding. They understand finality, universality, the biological causes of death. They can also apply the concept of death to themselves and experience a deeper emotional response to loss. And by adolescence, children develop a deeper, more sophisticated understanding of death. They can grasp the abstract, the philosophical, and existential aspects, and they also have a heightened awareness of their own mortality and often might struggle with implications of death. So this is just a little bit of guidance in how would you approach a conversation about death and dying with a child. Please understand where they are in their developmental stage. Please understand the concepts. Try and understand from them what the idea of death and dying means to them. Also remember that language for younger children is more literal. They don't understand metaphor and abstractions. So what's going to happen when a child comes to you and says, "What happened to grandma?" And you say, "She went to sleep and never woke up." She went to sleep and never woke up. What's going to happen to that child? Afraid of sleeping. Yeah. Yeah, exactly. Here's the other one. Yeah, where did Mama go? Oh, she went to be with God because God loved her so much. I don't want God to love any of my other family members, please. I don't want God to love me. I'm not going to go to church. I don't want to become God's favorite. Yeah. Yeah, exactly. So we need to be careful in how we present these concepts. Sharma Kapriya, you were saying, I was about to share my first experience of the concept of death. I remember when I was 5 years old. Are you able to unmute now? Because that sounds very interesting. Oh, no, I'm so sorry. I'm going to bookmark your story for the next time. Okay, so we have to be careful how the metaphor we use, the language we use, and how we want it to be received. Now, if some child comes to you and asks you about burial, if somebody was buried, and says, "But isn't that scary? How can you bury somebody?" Now, taking into account these concepts of cessation, of irreversibility, of causality, of those things, how would you talk to this child who is about, say, 5 years old? You want to give it a shot? I'm not saying this has to be a perfectly articulated conversation, but just now, if you think about cessation, causality, irreversibility, things like that, how would you talk to a child who's 5 years old, who's asking you about somebody being buried or cremated? Maybe you want to take. Yeah, go ahead, Seema.
Ma'am, can we tell them the reality in the form of storytelling or something like that instead of not telling them the truth or the facts? Instead of telling them that Dadi or maybe your grandmother has gone to see the God, or maybe she's asleep and she won't wake up again. So instead of that, can we tell them the reality based on a form of storytelling?
Okay, what kind of story?
Mm, maybe we will have to narrate a story with the help of certain toys or something, and to tell them that how the process of death. Firstly, to make them understand what do they understand by death, what are their concept of death, okay, and then to explain why we need to bury a person or how that process is, or if at all we do not bury, what else might happen in the form of story, at least in a least common manner we could explain the child the same thing.
Right now, as I'm listening to you, I'm feeling your struggle with this, okay? Because we're doing everything we can not to get to that point. And we feel that, okay, and it's great. No, there's a reason why fairy tales and archetypes and all that are in place. But my question was very straightforward. Somebody has been buried. The child has asked you a straightforward question about the burial. Now I've given you those concepts, course concepts. Storytelling is useful, Seema, in some contexts when it's a metaphor. but this is a straightforward question. So I see your point, but I'm also still struggling to receive what we might say. Someone else did want to say something?
Ma'am,
Yeah. Yes.
my father passed away when my daughter was 5 years old. So at that time, I was in Kerala at that time, and so we had the funeral fire, everything in the compound itself. So my daughter was asking why he's not crying when he was kept on fire. So she ran inside and she came and asked me. Then I remember what I told her. I said, no, his heart stopped and he died. So there is no life in him. So she was 5 years, but she was just listening to me. There is no life, so he will not know the pain. Then after that, no, on the fifth day when the bones are taken out, so at that time she came and asked me, so where did he go?
Hmm.
So I didn't have anything to say. Then first I said he would have gone to heaven. Heaven, I said. Then later, then I said, when a person is not there, when he has become ash, so that means that he's nowhere. But she understood and she was satisfied with my answer. I don't know how far she understood.
I would love for you to go ask her now, so many years later,
Yes.
how she
I'll
received
ask.
that, how she received that story. But I think that was a fantastic way of doing it, Nanda, because the fact you dealt with cessation. You said when people die, their heart stops, they no longer feel it. So they're not going to feel the distress. A lot of the time, the child is coming from that angle. And isn't it going to hurt them? Isn't it going to be painful? So we're saying they're not going to feel it. Yeah. I had a child once, say, but why did they bury my grandmother? So we had that conversation about the same thing, cessation. She's not going to feel anything. So then this child said, so if the worms come and eat the body, then what will happen? I said, well, then I think, it's just going to go in to fertilize the earth. So then this child said, oh, that means that flowers and all will grow. I said, yeah. So that's where grandma will be. And I said, yes, that's where grandma will be. Because, and it brought some sense of comfort, in the sense that, and these are not easy conversations. I just want to just highlight to everybody, these are not easy conversations. We will go back to our tropes of, Nana is a star in the sky and all of that will happen. And I'm not saying it's wrong. I'm not saying it's wrong to say any of those things, because there's a lot of value in a child's way of magical thinking. But I'm saying also be prepared for the child to ask you questions, not once or twice, but again and again. And that's something that we need to sit with them and acknowledge, and try and respond from a place of honesty, rather than a place of, this is not a conversation that children should be having, because what we're then doing is we're propagating this death denying sort of culture that we already are struggling with. Okay.
So I wanted to share something about my mother had multiple sclerosis, and so I lost her when I was 9, and so this experience, I've seen her sick ever since I was born. So like ever since I could understand things, like she was always sick. She was bedridden. She had lost her vision as well. And so there were many instances wherein like she was almost going to die. Like, I've witnessed those things. Like she was suddenly taken to the hospital, doctors coming in, and so that thing was always looming in my head growing up. And one day while I was in my math class, my maternal uncle comes and he says that your mother wants to see you. And then somehow I had this thing that, something has happened. Why would he suddenly come and ask me to come and say that your mother wants to see you? And I suddenly remembered the memory like the core memory that I have is like lot many footwears outside the door, and that is one memory I have. And but still, there's everybody was grieving, like, and so I think there's nobody sat me down and told me that this is what has happened to you. The only decent thing that they did was they didn't make me go through the rituals like shaving my head, and then going to school would have been another trauma for me. So I guess that is one thing that I.
Parag, thank you. Wow, that's a big story. And thank you for sharing it. Okay, I'm just going to sit with it for a couple of minutes. Shanmugapriya, your mic is working, I think, if you try.
Am I audible now, ma'am?
Yes, absolutely audible.
Uh, I just remember when we are talking today about grief and bereavement, this one. I think it's still very clear, or maybe a little bit, because that was my first experience of that, I guess. So I think during my first standard holiday or something, somewhere like that, my maternal great grandmother, she had a fall. She was fine. She was 95 plus at that time, and she used to be at the very good health. She had a fall at the back of the house and she broke her hip, and soon she deteriorated, bedbound, and soon she deteriorated. So all the family members, it's a big family, extended family. So everybody was called expecting her death. We were all there in our mom's native place, and my father was a doctor. So he was, as soon as he go, I remember my great grandmother asking him to check her pulse and everything. She's asking him, where is your strength in everything in action? So my father did everything, checked and everything, and he told her, like, everybody has come to see you. So she too knew that she is deteriorating fast, and a whole family is there. Till the great grandchildren, they all were there. So she was, the next morning, she passed away. Early in the morning, she passed away around, it must be 3 a.m. or something. So I woke up around 7 or something. Then my father came and told me that my mom was carrying at that time. My sister, she was carrying my sister. So she was crying terribly. She's first grandchild, and she was crying, the female grandchild of the family. She was crying terribly. So my father told me, sat me down and told me, see, yesterday we came to see Party. Now Party has died. Uh, so he told in the vernacular language. He didn't say she's sleeping or anything, I remember. So I checked everything right yesterday. At that time, she had all the things functioning. But now, when I checked, when I put the stethoscope, because I used to play with that, so he knows, I know, I so that love dove sound was not there. We couldn't see her breathing going up and down. So we know that she has died. And Amma is missing her so much. You know how close she was to her. So she's crying because she will not be able to talk to her again. She will not be able to see her after today again, because they will take her body from the house. So that is why Amma is crying. Everybody else is also crying. So you shouldn't be afraid of that. You shouldn't be afraid to see Party also. You should go. You should touch her feet before her body is taken away. So we will all be patting her and all those things. So from that time, I don't think that I had the fear of seeing dead or protecting my children from death. I lost my cousin when my elder one was about 5 years, 5.5 years old. So I had the same conversation with her. I was able to tell her that her uncle, the youngest of our cousin, is no more, and he had an accident. He was in the hospital, and we couldn't do anything. So we couldn't revive him. So he's dead, and we are going for the funeral. We are there for the funeral. So till my father's death, I never had the feeling that I had to go use euphemisms or metamorph for my children. Thank you.
Wow, that sounds like a multi-generational masterclass in how to deal with conversations with children about death and dying. So, great. Thank you all very much for sharing your perspectives. Thank you so much. I think, this is the kind of classroom that I think works best, where we all learn from each other's stories as much as we learn from the facts and the science. And this is the universality of death, right? So we all need to get the language around it. So thanks very much. So coming back again, because I don't want to go over time, coming back to this. So we've talked about, euphemism, metaphor, language, and the core concepts. So I'll ask you to bear in mind the next time if you have an opportunity to talk about death and dying with somebody who is with a child or with an adolescent, keep in mind some of these core concepts. What are the entry points that you want to go into that conversation with this person? And like I think Seema said something very important. She said she will first ask the child what he or she understands. Start with that. Always start with where the child is, what they've understood, what their concern is, and then they will automatically, if you listen carefully, they will give you that inroad into this conversation. Okay? And remember that the only good answers are the ones that are coming from a place of honesty and bearing in mind what the child is able to receive and hold. Okay, now also important to remember 3 things about children. Children will often see themselves as the center of anything that happens. It's called egocentricity. Okay. And it's not that they are selfish. It's not that they are being narcissistic. Children tend, because of the way their development is taking place, as when they're in the younger years, they tend to see themselves as the center of everything that's going on around them. And they are the only frame of reference. And if these conversations are not had with them, it can lead to guilt, self-blame, anger. It can lead to thinking that I caused this. This has happened because of me. Oh, she asked me to do this and I didn't do it. And she said, God will punish me. Is this the punishment? Okay. Please remember, children are at the center of their universes. We have to be able to have that conversation also to unburden them of unnecessary guilt. Okay. And it's also important to acknowledge what a loss means to that child and not to assume, oh, this child has lost his mother, so he might be feeling this. No, it's very important to sit with the child and sense what is going on with them in that moment. And like I said, to help them understand that it's not their fault. Children have an intrinsic fear of abandonment, which is highlighted. I mean, of course, there are children who are very healthily adapted and, attachment. It has happened in a healthy way. But at a time of death, one of the fears that is triggered is the fear of abandonment. The illness or death of a family member can threaten a child's sense of safety and security. And that might lead to fears of separation and loss with other members of the family. It's very important to find out if the child has any of these fears, also to reassure them that, everybody else is still there. Children will create order out of chaos. So if you don't give them information, they will fill the gaps. So those of you who studied Gestalt psychology, you know this. Humans will create patterns out of limited information, right? So they will try and fill the gaps in information with their version of reality and fantasy and half-truth, which might be very off the mark, 1. 2, it might actually be much worse than the reality is. Okay, so this is again another reason why we have to give them information. We have to sit down and talk with them, because if we don't do it, they are going to use their imagination to fill those gaps. And that might lead them to some not so very pleasant places. It's also important to remember that we have to simplify and clarify. You have to provide truthful information in simple and clear language, and repeated explanations may be necessary, especially when it's a very close person who has died. Let the child lead. Like Seema said, allow the child to set the pace and the agenda. We talked about setting pace and agenda in bad communication. Similar, we say, what would you like to talk about? And tell me what you're thinking about right now. They may need to revisit the same question multiple times to make information in new ways, especially as a child moves through those younger ages of development, because as the frontal cortex of the brain is forming, children are processing information in different ways. A child will come back to you and ask you a question that they asked you when they were 5 years old, 7 years old, 9 years old, because their worldview is also changing, because their biology and their neurology is changing. Okay, so you may have to revisit a loss over a period of time, several times with a child. Please understand that children perceive time very differently from us, and their understanding of time today is now, soon is hours away, tomorrow is never, my God. Have you ever sat in a car with a child for a long distance drive? Huh? Have you? And if you have, you know that their concept of time is very different.
When are we going to reach? How long will it take?
Yeah, yeah, yeah. And if you ever want to know how a child perceives time, please travel with them. It's very interesting. So remember that when you're talking to them, their perception of time is very, very different from an adult's. 20, yeah, torture. Yeah, yeah. Okay. So what do children need from us? They need these things. They need reassurance. Okay. Children may ask seemingly simple questions like, "Can I have my sister's toys now?" This is, when a child has died and the sibling has survived. Or, "Who will take me to school?" when a parent has died. These are not just practical questions or selfish questions. Like when a child says, "Can I have my sister's toys?" your first reaction might be, "What? What kind of a question is that?" What this child is asking you is a landscape question, and is trying to restore familiar landmarks and routines during a difficult time. And in this case, what that child might be asking you is, "Now can I have your attention?" So remember that these are landscape questions. Who will take me to school? What sort of a question is that in the middle of so much, that is going on? He's basically asking you, what will stay the same? Seema, you had your hand up.
Yes, ma'am. So I wanted to share a small little experience wherein it is always important to address that for the child who is the one who is died. How was their relationship with the dead person? Okay, so it is not that simply we assuming that the child has lost his or her grandmother can be very depressing or type of causing trauma or grief to the child doesn't work up every time. The relationship which they shared with their grandmother is always more important, because what I came across was a 8-year boy who lost his grandmother, who used to torture his mother a lot while she was alive. So the time when the grandmother died, everybody was assuming that the child might be depressed or grieving or something like that. But to the very opposite extent, the child was happy.
Hmm.
And to know that what was the reason behind it, so it was like I wasn't happy with the type of treatment my grandmother used to treat my mother. So today, since she is no more, so now I'm happy that finally my mother got relieved. So that way, it is always important to know that what kind of relationship was the child sharing with the died person.
Excellent point, Seema. And in fact, when we go into grief and bereavement, we will specifically be talking about what we call mediators of mourning. And I'm glad you brought this up, because there's a tendency to assume that death leads to grief. That's not necessarily the case, especially when there are very complex and complicated relationships in the world. And so it's very important. So again, leading from where the child wants to start, right? Rather than us assuming that the child must be sad, or the child must be depressed, or the child must be, whatever, anxious. Children are extremely perceptive also to nonverbal cues of language and relationship between people. So depending on who that person is in the grand scheme of things. So here, like you said, the child is happy because he thinks that the mother is going to have a better life now. So yes, always let the child lead, and rather than us assuming that it's being, that what they're feeling is according to what we think they should, or things like that. So thank you, Seema. That's a very, very valid point. So coming back to landscape questions. So younger children will ask you landscape questions like, "Okay, who's going to make me lunch now?" or just going by the role that that person played. What they're trying to do is establish a sense of what will remain the same. So also, um, the way to approach a conversation like that, when we say reassurance, it's not just saying I am here, it's also saying what will stay the same. We are still going to be going to Delhi to visit your grandparents in the summer. We are still, yes, we will take some time off school, but in time, you will be seeing your friends again. Things like that. They need to be reassured that the whole world has not turned upside down because this has happened. So please be prepared for landscape questions, which are often disguised as seemingly selfish questions. What they're really trying to establish is what is going to be normal and stay the same for them. Okay. Addressing not just their concerns right now, but prospective concerns. So older children may have longer term questions. What will I do on the holidays? Will I be able to go to college? These prospective landscape questions reflect their need for reassurance about the future. So younger children might want reassurance about the present. Older children may want reassurance about the future a little bit. Okay, so learn to recognize these landscape questions. And we need, through all of this, to provide steady support. Children need steady, reliable reassurance from adults that whatever their questions, no matter how straightforward and complex, we will meet it with empathy and honesty, age-appropriate answers. We shouldn't ridicule them. We shouldn't dismiss them and say, "Arey, you're too young for that. This is not your concern, Baba. Don't worry, I'll handle it." It's not that. If the child is expressing a concern, that means it is playing on their minds. Okay. And our job really as adults is to restore a sense of security and stability. So coming back to the question, what Seema shared. Now, when a child responds to you in a way that is like how this child has responded, saying that I'm not feeling sad, my grandmother has died. I'm feeling happy that she's died because my mother has a better life. How will you hold space for that child? It's easier to comfort a grieving child than to sit with a child who has just told you that they're not feeling grief. So how will you hold space for a child who has just expressed an unconventional emotion like that, or what we consider unconventional emotions? This is just something for you to think about, and we can come back to that, or maybe you can share it on the WhatsApp group that you have, and have I'd be interested to know what some of your responses are. Or maybe if we have time at the end of the session, we can come back to that. Okay. And what children also need is not just reassurance, but they need to be able to be children and to express themselves and their feelings. So children will often express grief and other difficult emotions through behaviors rather than words. And you'll see this in their play. You'll see it in the games they play. You see in their drawings. You see how they're performing at school. You see how they're interacting with other people, children, other adults. And those are really powerful ways. Now, we have to give them that safe space for them to express themselves. We can't, now that we've done a class on communicating with children, jabardasti go and sit down with the child and say, tell me how you're feeling. If the child is not wanting to talk to you, they're not wanting to talk to you at this point. There's no forcing them to talk, but also observe their behavior, because their behaviors will tell you a lot. Children have a lot of energy. They have to be able to give it some sort of direction and channeling. Okay, running, playing, physical activities, these are healthy ways to release anxiety and sadness in children. Children are physical beings. Most children are physical beings in that sense. And encouraging these outlets is a good way, is a constructive way to manage their emotions. And older children may find solace, and they might find it helpful to write stories, letters to their loved ones who have died, and to express their thoughts and feelings. And so just a word about the pictures here. These are all kids that we've talked about. And this boy was not very verbal, but once we gave him these blocks to work with, he loved it. I mean, you can see it on his face. And then he would use that to communicate with us. We had superhero day one day at the clinic, and various children who were there for different kinds of treatments, they chose what superheroes they wanted to be, and that treatment was done, but we just hung around with them for an hour or two, just letting them play, because they also come from households where play is a luxury, where it's not something that and a lot of them were not able to play with other children. There were siblings here who couldn't play with their own siblings because their siblings were sick. So this was a really safe environment for them to really sort of express themselves. We got them to do art. We got them to do lots of things. And this became a weekly ritual at our palliative care clinic. And oftentimes, I'm very happy to tell you, our palliative care clinic at a government medical hospital was the one room from which you heard a lot of laughter. And I remember once, like, this junior doctor popping their head in and saying, "Is this the palliative care room?" And I said, "Yeah." I said, "This is the room we expected a lot of crying to come from." And well, actually it turned into one of the most joyful rooms in the whole medical hospital, the government medical hospital. So it can lead to a lot of really, pent up emotion coming out, and then children relaxing. So it's a very good way to help them express their emotion. So I would have been done with this actually, but because of what Parag brought up right in the beginning of the session, I'm just going to very quickly touch upon one aspect, and that is adverse childhood events. This is a study that is very famous now. And if you just Google it, adverse childhood events, it was a study that was done over a period of time. And it's actually quite a seminal study because it says that there are different kinds of adverse experiences or events that a child can go through. And these are called ACE, okay? So adverse childhood events. There are different kinds. So there's abuse, which is actual abuse, physical, emotional, sexual abuse. There's also neglect, physical neglect, not hugging your children, not showing them affection, not being, emotionally available to your child, being cold, distant, and of course, household dysfunction. That's a whole other section which has mental illness. It could have, crime in the family, violence, domestic violence, substance abuse, broken homes, whatever else. So these are the three broad categories. Now, what adverse childhood events really says is that the more number of adverse childhood events a child experiences, the higher their risk for these things. Lack of physical act in terms of behavior, lack of physical activities, smoking and substance abuse, drug abuse, and being truant at work, not being able to commit to your work, things like that. Possible risk outcomes in terms of physical and mental health, it could lead to severe obesity, diabetes, depression, suicide, lots of things. So the more experiences a child has in these categories, the more likelihood of bad outcomes in terms of mental and physical health. Why are we talking about this here? Because if we're dealing with children, we have to understand what their adverse experience is, and we have to work towards mitigating it. And I'll just close with this slide. I'm going to ask you to start from here, the green one, the first green one, adverse childhood experiences. We won't go into social condition and generational embodiment. I mean, that has to do with displacement and all kinds of things like communities experiencing trauma and so on. But chances of a child experiencing adverse events is higher if they come from that kind of historical background also. I mean, I won't go there. But if a child has adverse experiences, literally at a biological and neurological level, they have disrupted development. The way in which they handle stress, the way in which they cope. Now, for instance, I'll give you an example. If a child approaches their mother for affection and validation, and if the first time the mother hugs the child, the second time the mother is like, "Arey, I'm busy, go away." The third time she hits the child and says, "Stop irritating me." The child is not sure how the mother is going to react every time he or she approaches. What does that do? It activates a hypervigilance in the child. I'm not sure. The child is not feeling safe. The child is always a little anxious. Acha, is baar kya hoga? So what that does is that particular neural pathway starts developing more. It's like when you go to the gym and you only do an upper body workout, when you get in a fight, you're going to use your upper body because that's the strongest muscle. You're not going to use your legs, which are weak. So similarly, this is a pattern. Like, so someone was saying that it starts showing in their intimate and emotional relationships with other people. It determines how they will cope with stress. It will determine how they cope with what they think is a threat. So neurobiology also gets developed. You can read, there's this beautiful book called The Biology of Belief. There are several books like that which will actually tell you how these adverse events actually affect the neurobiological development. Now, if your neurobiology is disrupted, you might have social, emotional, and cognitive impairment, which manifests in the form of how you interact with your environment and people in it. You might, and there's a worsening of health behavior. So, like we said, more chances of substance abuse, more chances of risky behavior, more chances of those kinds of things, which leads higher probability of disease, disability, and social problems and death. So there is a significant although this is a little bit of a segue into some developmental psychology, this is why it's also important for us to remember that how we help a child deal with a difficult experience in their childhood may contribute or mitigate the future course of their physical health, and also how it manifests in their behaviors and their relationships. So this is a very fascinating topic. If you'd like to read about it, adverse childhood events is something that is now in mainstream literature, and it really sort of informs the way in which we approach a lot of these subjects now. So I'll stop with that, thankfully ahead of time, and let's spend some few minutes. Yeah, let's spend some, yes, body keeps the score as well. Let's spend a few minutes just sort of reflecting on maybe some of the things that have come up for you in this session. That is very ominous silence. But any questions about any specific sort of scenarios that you might have encountered, or even reflections?
Good evening, ma'am.
Good evening.
Ma'am, actually, the class was very nice, and particularly, I was experienced when my brother was diagnosed as retroperitoneum cancer. I was around 7th standard, and all the trauma, like 2 or 3 years, my parents were not with me. I was left alone with some relatives to be taken care, and all they were separate place, and all as you told, many things happened. But my question here is, if second child is having a problem, or the first child is diagnosed, so whom we have to reach out for help in this condition?
So Alvin, thank you for sharing that insight into your life. You cheerfully skipped over it, but I'm sure it was not easy at all. So the question is, you're asking from a healthcare provider's perspective who to approach in the family? Okay. I would say a little bit of psychoeducation is important for everybody concerned, whether it's the parents or extended family. I'm also mindful of the fact that the parents are under tremendous stress at that point. But that doesn't mean that, it's not that they don't love the other child. It's just that they're dealing with the crises of the disease. And I feel like there are concerns that they harbor for their other child, but right now it's a priority. And also, whoever they encounter in the healthcare system will always talk to them about the child who is not well. So I would say be the first one to talk to them about the child who is healthy. And it might open up their own concerns. They might say that we don't have help at home. We don't have somebody who we can safely leave our child with, and have. So again, going back to the eco map, let's look at the support system. If there is nobody within the immediate family who can step up to help these children, then who else can we mobilize? Have a conversation with the other child. Again, let's not go over the head of the child, right? Let's sit with the child and say, how are things going for you? Have a conversation with the school. See how the child is doing at school, because very often it's in school that other behaviors become manifest. If there is a decline in their grades, if they're getting into more arguments and fights with other children, if they are bunking school, if they're, those are all signs that the child is in distress. So I would say, from an interdisciplinary perspective, speak to the child, speak to the parents, speak to whoever is in the social constellation of that family. Yeah. Don't forget the genogram and the eco map. This is where those things come in handy. Okay, so Hannah, did you have a question? I saw you unmuting.
Yes, ma'am, I do have a question. So basically, we were talking about how the elders are communicating with the children. So I have a question totally vice versa. Like, how will the children have to communicate that to their family members? Supposing, like, I had to face an incident where my maternal grandmother passed away on a sudden note, which was not at all expected. So one day morning, like 5 days later after New Year, like in the year 2022, I get a call in the morning saying that my maternal grandmother has passed away. So out of that, it's very unexpected. We had a roller coaster of emotions coming up, like what happened, how, and all of that. So immediately, my mother's sister called me and saying, "Can you please inform your mother about this, because I'm not able to reach out to her on call." So I just did what I was asked to do. So I called her and I asked her where she was, and she already had reached the office for work. So I did not reveal the bad news, but I asked her to call up her sister to inquire about this. But later, my father kept on this thing at me saying that, why did you do this? Like, you being a psychologist did this. Like, so I don't know. I didn't know, like, what could have been done at that point? It was like a blame on me, like, I being a psychologist couldn't convey the values properly. Sorry.
Hannah, I'm so sorry that you had to do that, or that you were the one that it landed on. Firstly, let me just make it abundantly clear that just because you're a psychologist doesn't mean that you have to be a psychologist in the family. And oftentimes it is most difficult. I taught communication and end of life care for about 15 years. And when I had to have a conversation with my mother, I could not. And it's very, very different when you're doing it in a professional setting than when you're doing it in a personal setting, especially with somebody who's very close. So firstly, I just want you to separate those two tags. Hannah and the psychologist are not necessarily the same person at home, okay? Secondly, in times of distress, like you said, this was a sudden death or it was an unexpected death. Did you say
Yes,
that?
yes, really unexpected.
So also remember that emotions and emotions run high and are very volatile, and people end up saying some things that they don't mean. Okay. And I'm not saying, I don't know your relationship with people in your family, but in that moment of distress, oftentimes things will come out like this. Why didn't you do it?
Yeah.
Or you messed up in that
Yeah.
moment. Any one of them could have picked up the phone and spoken, no? Any of the elders in the family. So how we behave under stress and strain and under sudden shock, sometimes it's our fears that are coming up, it's our own anxieties, our own, we sometimes regress into a space of child. I mean, you're a psychologist, we know this, but I would say, I think what is probably more hurtful is not the fact that you weren't able to convey the news at the time, but the fact that it's now being, you're being measured by it. maybe this is a good time to have a conversation with the rest of the family about that. Because I mean, what happens sometimes is that these are the scars that carry on. You know, what happens after the death of somebody sometimes complicate the grieving process, and this could very well be something that does that. And so you started off by saying, how should a younger person handle it?
Yeah.
There's no formula. There is no formula. There is no template, and especially not in a personal setting. Absolutely not. I, I, as of right now, I want you to please absolve. You need to look at, and not so much how you responded in that moment of shock. So if you like, we can have a separate conversation about that as well.
Sure, ma'am. Sure.
Okay. Are you okay for us to close?
Yes, ma'am.
Yeah. Okay. All right. So I really want to thank everybody today who spoke, and also those who listened quietly, because just because you're not speaking doesn't mean that you don't have your own experiences to share and absorb. I hope that beyond the academic also, we are, you know, I hope certain things are settling. I know some of these conversations are probably evoking emotions also. So if that has happened for you, I'll ask you to take a few minutes to just sit quietly for a little while after the session is over before you move on to the next task. And if any of you are feeling unduly activated, or you know, feeling uh, distress of some sort, then you can let Arya know, and we can have a conversation separately. Okay, so take good care, everybody, and this floor is open for conversation. So you know, if you have any questions that you want to separately address with me, please do get in touch. All right, Arya, thank you very much, and
Thank
I'll
you,
see you
ma'am.
all.
Thank you, ma'am. It was such a wonderful session as always. And dear participant, let me say something. I'm very, very, very proud of this batch actually. Thank you so much. See you in the next session. Bye. Till then. Bye.
एक काफी है एक काफी है
Thank you, ma'am. Thank you, Arya.
Mm.